Hello, my name is Mike. I am 37 years old. I live in Moab, Utah, and I wanted to record this as kind of an account of the experiences that I'm going through right now with a herniated disc. Actually, I'll list off all my symptoms right now, and as well as diagnosis. Back pain, sciatic pain, sitting for longer than an hour, makes me shift all over the place in terms of trying to find something that's not painful. On a scale of 1 to 10, I would put it at like a 5 or a 6. Tolerable, just to the point where I'm not taking medication. Medication just seemed to dull it for about 45 minutes to an hour, and then I'd consistently have to take more and just decided against it, and I'll just deal with it. As well as the pain also makes me, it's a good reminder of not to bend or lift or twist at the current, at this current point in time. In terms of the symptoms I'm mainly concerned about, that I'm going to get into here in a little bit about treatment. I'm looking down at my toes right now. I have a completely numb big toe. You could put a nail through it right now and I probably would not feel it. The toe to the left, my pointer toe, so if this is my big toe, then my little toe, the toe next to your big toe, that's also fuzzy and numb on the outside and above the nail. And then the outside of my foot, actually, I'll show you. So, let me turn this around. No, I guess I can't do that. Anyway, completely numb. Can't feel really much anything there. It's dead. This one as well is super fuzzy right there. And then to the outside of my foot, this is all fuzzy and weird feeling. And then around the side here, this piece of muscle coming up from not in my Achilles, but right here, all of this is numb. And it's been going slowly but surely up my leg. That along with when I walk, when my left foot is the furthest away from my body as I'm walking and extending my left foot out, I get nerve pain straight down from my lower back into my feet. It causes me to walk with a limp, Quasimodo style, dragging my foot type of things, just so I don't feel that pain. So that's the main concern. This all started, the nerve symptoms of my foot started on February 3rd, 2017. Definitely freaked me out. 2 days later, the weakness started. Like it was, instantaneous from, 1 minute to the next. Like I had an immediate stoppage of being able to do anything. So to show this, I'm going to use this foot as an example. If I push down, I can raise up with my foot. Dorsiflex, I guess, is the terminology for this. Sorry, I'm not probably covering the microphone. I can raise my toe on my right foot. My left foot, if I press down, I can wiggle, but I cannot, by comparison, lift up with the same amount of force, as well as the rest. I can spread the toes, and sort of wiggle my toe like that, but I definitely cannot do this. So that freaked me out. February 5th was the date that I noticed the weakness. February 6th, I started calling around trying to figure, out answers, and I more or less spent 3 to 5 hours a day on average in that, realm, researching, watching YouTubes, looking at medical journals, trying to figure out how to fix this. February 8th, I got an MRI that confirmed a left lateral severe herniation. I saw a doctor in Denver. I'm going to leave names of doctors out of this until after my surgery. The first doctor I talked to basically said 50% of patients heal on their own, 50% of patients need surgery. Of the people that need surgery, 50% of them have worse symptoms and 50% of those people get better. That sounded like a sales pitch of, stupid proportions, so I went to get a second opinion. The second spine surgeon I saw was in Glenwood Springs. Was really satisfied with the explanation. And I'm going to go into what I've been doing since February 3rd and actually January 8th when the herniation probably started. So it's not like I've just been doing nothing. I have a free-floating disc fragment, L5S1, impinging on the left lateral nerve root from my L5, and basically is causing these symptoms. The amount of pain that I'm in is tolerable. So most people would say, why would you get surgery? Just wait. But most of the research studies that I've been looking at and reading about and understanding, and I can actually link to some in the video, below so people can see what I'm referring to. The sooner you take care of the weakness issue, numbness, I could live with a numb toe the rest of my life. I'm not concerned about numb, but I'm a cyclist. I race, and it's very much part of my identity. And I did not want to leave that to crossing my fingers and chancing that my body will heal itself on its own. The longer I wait, the more likely that the nerve and the weakness, the nerve symptoms will become permanent, or some percentage below 90% of use. I'm looking for 100% back and get my life back. Like I said, I'm 37 years old. If I was 70, maybe, write that off to a long life lived, but I'm nearly halfway there, and I want to still enjoy the rest of my life the way that I've been living it. So as of yesterday, I elected to go forward with scheduling surgery for a microdiscectomy. And yeah, a few other things to throw into the mix here that, kind of make this my case a little bit different from a standard herniated disc, even though that's the symptoms I'm mainly concerned with. I have grade 2 spondylolisthesis with a spondylosis, which is 2 fractures on the pars of my vertebrae L5, which is causing, pretty substantial instability of that joint of the L5S1. And I have 8 millimeters of spondylolisthesis anterior, so it's going forward. So my MRI, you can see it, distinctively, with a one disc below and one disc above, and it's actually moved forward by 8 millimeters. So having the microdiscectomy is definitely going to destabilize that more, and raises the risk of me needing a fusion to 60 to 70%, according to the neurosurgeon that I spoke to yesterday. While I'm not necessarily comfortable with the idea of getting a spinal fusion later on, the longer that I do wait in hopes of never needing a spinal fusion, and having these nerve symptoms affect, my life of walking around with a limp and having nerve pain, potentially could be substantial long term. Now, the nerve pain, yes, 6 months or a year from now, if I elect to get the surgery then after I wait, the nerve pain could go away. But the neuropathy or radiculopathy is, depending on, which symptom you're speaking to, the fact that I can't raise my foot and raise my toes and pedal a bike the way that I used to is not something I'm comfortable with. So I'm going to, assume the risk of the microdiscectomy, hopes of getting my leg back, and then do a beyond comprehensive ab and core routine, whether that's yoga, Pilates, and everything in between. I would already say I have a pretty strong core, but I could definitely work more on the stability ball of the micro movements of the lower back to make sure that I am improving my posture, whether it be on the bike, walking around, or just sitting in a chair. So that's where I'm going with in terms of the surgery. Today is February 25th. I'm hoping to have the surgery on March 6th, and I will do a follow-up, hopefully 24 hours or immediately after, if I can remember, having this surgery done at the Valley View Spine Center at the Valley View Hospital in Glenwood Springs, Colorado. And yeah, hoping for good outcome. Since January 8th, I've been doing roughly 2 hours every morning of stretching, tons of different styles of stretches. I won't go through all of them, but primarily focused on the lower back and hamstrings, PNF stretching of my hamstrings, also doing planks, pelvic tilts, transverse abdominis activation, which if you've never done them, it's, just figuring out where that muscle is and how to fire it is, a task. The first couple of days, it was everything I could do to actually have my brain turn them on. Now I can do a lot of ab exercises with them engaged, and I have to say, like, I can't wait to go lift heavy boxes again, knowing that you can engage more of your core, just more or less by activating that one muscle that helps the rest of your abs and everything, engage as a complete unit. But yeah, that's about it for me. As I'm sitting here right now, like I said, I can feel the pain. It's manageable. I'm not in writhing pain laying on the floor. I'm functional. I'm actually getting ready to go for a bike ride. Probably be my last bike ride of, probably 3 months from now. I'll maybe hopefully go for another bike ride again. But yeah, I'm optimistic. I'm hopeful, and believe that I'm making the right decision. Guess time will tell. But thanks for watching, and I'll update soon.